Karen Lee was in the Commons as Lincoln's MP. Now she's on the NHS frontline. After the 2019 general election, Karen went back to her first profession, nursing, and now she's working on a ward at Lincoln County Hospital, and I'm pleased to say she's with us on the programme now. Karen, good afternoon.
Good afternoon. How are you?
Yeah, I'm well, thank you. Thank you so much for joining us on the programme today, because I think it'll give us a bit of an insight as to what is happening in our hospitals. I mean, from the Commons to the COVID ward, what a challenge and what a change that must have been for you.
Yeah, it was certainly a challenge. It's very different.
You were determined that, having been, the MP, that you would go back to nursing, though.
I wasn't sure what I wanted to do originally, because when you first lose your job, I lost the seat, obviously, you're in a bit of a what's hit me sort of a situation. So for a couple of months, I didn't know what I wanted to do. And then as COVID unfolded, I just thought, for two reasons, really, I need to go back to nursing. First of all, as you say, it is my profession. It is what I do. But as well as that, my son was very ill 10 years ago. He had the H1N1 swine flu, and he was in ITU for 3 weeks. He nearly died. And I just had a really strong sense that I wanted to pay back the kind of care and commitment that he got. So there were two reasons, really.
I don't know how long you'd been out of nursing, but did you have to retrain? Did you have to do extra qualifications to get back into nursing?
Well, what happened, I left an acute clinical area in 2015 and I went to clinics. So I stayed in nursing, but it wasn't in the same kind of setting for just over 2 years. And then I went to Parliament for 2.5 years. So I maintained my registration through different things that I did within Westminster. And I did that alongside somebody from the RCN. They supported me with that. But when I went back, I did have to do quite a bit of different kinds of training. And I also had a period when I was supernumerary. But I went back to somewhere that I'd worked for 12 years. So there were changes, of course, but basically it was all second nature to me, really.
And what wards are you working on now?
I'm based on the cardiac unit, but obviously because we are short-staffed within the hospital, staff are being asked to move around to different areas. I did that on Boxing Day. We have to, because there's such a high rate of staff sickness at the minute, staff really do need to be, and I mean, to be fair, everyone is prepared to move around just so that the staff that we have got are shared out between all of the areas, and all of the areas are properly staffed.
And I would imagine everybody's just completely shattered, aren't they? This has been going on now since last March.
Do you know, we are absolutely shattered. I've got two friends who had exactly the same week's leaves booked as I had, and we none of us got our leave in. I had a week at the end of November that was due, and I was allowed to take one of the shifts, but the other two that I would normally work, I went into work through my annual leave, and I was due again this week because it's my birthday week this week, and we've been okay to take this week, but I'm fully prepared to get a text saying, hey, can you come in? And if I'm asked, I'll go in.
And has that been happening when you've been off shift, that because things have been desperate at times, you've had that contact saying, is there any chance you can come in and help?
Yes, absolutely. Yeah, the banks send out messages saying, if anyone can help, please let us know what you can do. And to be fair, everybody is, and we all pull together. And I think it's really important as well to stress this isn't just nurses, it's healthcare support workers, it's our housekeepers, our cleaners. I was thinking today, our ward receptionists too. We've got 3 different ward receptionists. If it wasn't for them, because we have constant phone calls because people can't visit and they're anxious, our phone just never stops. And if it wasn't for our wonderful receptionists, Judy and Wendy and Nikki, we'd be answering the phone all the time, quite rightly. But, you wouldn't be able to get on with anything else. So,
I think you make a really good point there, Karen, because, in so many organisations, it's the background staff that we don't see. We know that everybody's working incredibly hard. I mean, what is the atmosphere like in the hospital? Is it different now to what it was back in March and in the summer of last year?
It's certainly a lot busier now than in the first wave. It's much, much busier. I can see that. I mean, I think the numbers bear that out, don't they? When you're there, Melvin, you just get in and you get on with it. And people ask you about some of the peripheral stuff and you don't know because you just get in and you get on with your job, and at the end of a shift, you're very, very tired. I mean, Christmas, as I said, I worked Boxing Day and it was just flat out for 13 hours. For 13 whole hours, we just went, and I went to a different area that day. The staff were lovely, but it's different when you're in a different area. You're just a little bit out of your comfort zone. You're still a trained nurse and you're still safe, but it's just a little bit different. But I don't know, in some ways it builds the camaraderie as well. And I don't know, everyone's just so great. And I forgot to mention our porters as well. Our porters are running all over the hospital, everyone just pulls together.
And what about your safety yourself? What sort of PPE are you wearing? When you go on the ward, are you completely protected? How do you feel about it?
We wear masks the whole time. The only time you ever take a mask off is when you're actually swallowing food on your break. If you're not actually eating on your break, you still have your mask on. Gloves and an apron, and that's to go to every single patient contact, changed between every patient contact. If I'm nursing patients who have COVID, I put the visor on as well. I've not yet nursed anybody who's actively coughing, but I have nursed patients who have got COVID, who are positive, and I wear the mask as well then. We're very, very careful about not spreading it. It's really important.
And the other important thing I think to get across is that, since last March, the way of treating patients that are coming in seriously ill, you've learned so much over the year, haven't you?
Yeah, like testing them. Yeah. Well, we're absolutely thorough about testing anyway. And it's not just a test when they come in. They're tested regularly when they're in tune. We're really, really careful. And at the beginning of your shift, we'll be told, right, you've got A, B and C. They all need the COVID test today. Make sure, however busy you are, that you get that done. I mean, as staff, I have to have the lateral flow test twice a week on Wednesdays and Saturdays. We've also got thermometers now to take our temperatures twice a day. We are really, really, I have to say, I feel that the staff, that the trust are looking after us as staff and, putting everything in place that we need.
Had a fantastic story earlier in the programme. Gentleman, Joseph, 99, admitted to hospital the Tuesday after Christmas, 99 years old with COVID. He went home last Saturday. The joy of that. And we are hearing of more and more people that come in seriously ill, but they're being treated in hospital and they are going home, aren't they?
Oh, they are, absolutely, yeah. I mean, of course, there are people who are dying. That is a fact. We all watch the news. But lots of people come in and they go home. Far more go home than don't go home. And not everyone has the terrible symptoms, but the trouble is you can never predict who are going to be the people, who are going to get those awful symptoms.
And are you getting a range of people coming into hospital now? Is it younger people coming in as well as older people?
Yes, but I've not seen anybody very young, but I think that's more about the area that I work in. The area where I work tends to be either elderly people or perhaps middle-aged people. I've not seen very many young people, but I think that is purely down to the area that I work in.
Now, as your front line, you've had your vaccination. How was that?
Yeah, I had my vaccination last Tuesday. My mum got hers. My mum's 82, and I took my mum for hers on Thursday. That was done through her GP. Mine was done through the hospital. I was literally at work last Monday, and my boss, I said, Carolee, do you want a vaccine? And I went, yes, I do. And she said, are you going to come in tomorrow on your day off? And I said, yes. And I did. I went last Tuesday morning. My arm was a bit sore afterwards, and I'm not a baby. I've had a lot of jabs as a nurse, and it did make my arm a bit sore, but nothing that 2 paracetamol wouldn't cure. Had a bit of a headache the next day as well, but again, 2 paracetamol. And some of my colleagues have said that, but it's better than COVID, that's for sure.
Indeed. Now, I know you were listening into our phone-in on Friday. An awful lot of frustration from people saying, look, we haven't had a call yet, we haven't had a text yet, we haven't been invited for ours yet. It is early days. This is early stage of this rollout, really, isn't it?
Yeah, I understand that. I mean, my mum got it because she's 82 and her GP, we're with Brayford Medical Centre, they know to ring me. That's marked down on her notes, and they literally rang me, and I took her. It was only a few days later, and to be honest, I could have really done without it on the one day off that I had left, but I really wanted her to have it. And it was a fantastic operation. We went to just off Tenter Cross Street. It was really, really well done. I have to say the staff there were marvellous, really efficiently, safely done. But the thing is, I mean, I know this from being in a hospital, please don't ring, because when you're trying to get on with your job, you know why people ring up, because they're anxious. There's no problem with that. But if it's something that you're not going to be able to resolve on the phone, then that takes you away from doing your job. So don't ring. They will ring you, and I understand they're just working their way through, aren't they?
Yeah, and we had a call, didn't we? We were talking to a GP on Friday's programme saying, please don't phone the medical centre to ask when your appointment's going to happen, because we will contact you, because, all the medical centres are flat out as well, aren't they?
They are. It was very busy when I took my mum on Thursday, very busy. It was constant. I think I had about 2 or 3 days notice of taking her, and that was it really. But, I snapped it because I want my mum. I've not been able to hardly see my mum. I support my mum. But because I'm probably the person she was absolutely going to catch it off if she was going to get it off anyone. I've tried to keep, at a distance.
And Mum, has she got an appointment now for the second vaccine?
She's not got hers. I've got mine. I had mine last Tuesday, and my second appointment is March the 23rd, I think it is, something like that. My mum's not got her second appointment yet, but I'm sure it'll be sort of in line. Interestingly, my mum didn't have any side effects at all.
And the other side of things is, of course, that changed, didn't it? And I know when the Oxford came out that basically they were saying, yes, it would be up to 12 weeks. But then the change was with the previous one that was already available. Are you happy working in the medical side that it is, it's going to be up to 12 weeks to get that second jab?
Yes, I am, because I think the broader... The immunity, the greater number of people that you can get vaccinated, then, that is the real key to breaking this. And I have to say, I've been out this morning to get, my mum will only eat Marks and Spencer's ready meals for her lunch, and I've been straight to Triton Road to get them and straight home.
Bless
the
her.
number of people that are out, don't. The number of people that are out, and I went out on Saturday to get my own shopping. I'm worried that people aren't taking this lockdown seriously enough, and I think that's another reason why the more people we can get vaccinated, the better, because people just aren't staying in the way that they did the first time round.
But is there a danger, as we hear more and more people have had the vaccine, that some people think, oh, well, we're out of this now, we can move on with our lives?
Well, I really hope they don't. I have to say, if they worked where I work and saw the prevalence of COVID, because it really is, the numbers are high and our staff sickness is high because we're in amongst it the whole time. If they saw that, then they wouldn't have that kind of attitude. But I was out on Saturday afternoon. I got a new freezer and I needed some freezer stuff to put in it. Went to Tesco's, and honestly, it was like an ordinary Saturday. And it really frightens me that people aren't taking this seriously enough.
I also was struck by the message, was it the head of the NHS in the press conference last week? Really, you could see how angry he was at people who still say, this is just all made up. This isn't really happening. I've spoken to relatives of people who have been seriously ill in hospital, and they've been told, oh, it's not real, it's just all being made up. And this is somebody who sat with loved ones at their hospital bed thinking that their loved one is not going to go home. What do you say to these people who say this isn't happening?
Well, I think your first reaction is anger. I lost my stepfather. He died of COVID. He went from a nursing home in Lincoln to A&E, and he died of COVID a couple of weeks later in April. It is very, very real, and I see it at work. It is very, very real. And, I do understand the comments about worrying about the economy and people's mental health. Of course, everything's a balance, but at the end of the day, if people get COVID, those other things go out of the window anyway. And if we all just respect this lockdown and just lock down properly, and I don't mean the way we're doing it now, I mean much, much more strictly than we're doing it now. If we did that for a time like we did further back, I really think that we could break this vaccine, because the trouble is, the more people COVID deny and don't want, if they don't want the vaccine, that's fine, let them not have the vaccine. But as long as most of us have it, we will get the other side of this. But I just worry that at the moment, people aren't taking it seriously enough.
Karen, I've taken enough of your time. This is a day off for you, believe it or not. So thank you so much, because I think you've given us a real insight into what's happening in the hospitals. Karen, thank you for that. Thanks to Karen. Thanks to anybody who's working on the front line, behind the scenes, whatever you're doing, you're keeping it working. And I know that the time and the effort is really appreciated. And I know many of you get phone calls and say, look, I know it's your day off, but can you come in and help because we're short of staff? Let me just run through the details of the hospital hubs, which are at Lincoln County and the Pilgrim at Boston. The other hubs we have for primary care across the county, which are currently issuing the vaccines: the Louth Community Hospital, the Table Tennis Club at the Mears Centre at Grantham, Waddington Surgery, St Mary's Medical Practice at Stamford, Franklin Hall at Spilsby, Sidings Medical Practice at Boston, Ruston Sports and Social Club at Lincoln, and the Portland Medical Practice in Lincoln as well. And as I've mentioned, we touched on this on Friday's programme in the phone-in. Lincolnshire, another 5 hubs will be announced this week. And as soon as they are announced, we will let you know here on BBC Radio Lincolnshire.